If you're over 60, there's a silent threat hiding in plain sight, sitting in your bathroom cabinet, tucked into your nightstand, or picked up at the drugstore without a second thought. It's not a rare disease or a freak accident. It's the everyday pills millions of older adults use for sleep, allergies, bladder problems, pain, mood, and anxiety. Medications that can quietly dull memory, cloud judgment, and push your brain toward decline. The scariest part? These drugs don't feel dangerous. They feel helpful. They tuck you into sleep, dry up a runny nose, calm an overactive bladder, smooth out anxiety. But for an aging brain, the cost can be devastating. Confusion that looks like just getting older, falls that steal independence, and a creeping fog that crowds out names, stories, and the details that make your life yours. This is not about scare tactics for the sake of fear. It's about reality, what neurologists and geriatric doctors see every week. Older adults on harmless pills who begin to lose their edge, then their confidence, then pieces of their life. 4 medication groups in particular come up again and again. Each one is common. Each one can interfere with the delicate chemistry your brain relies on to think, plan, and remember. And each one is often prescribed or purchased without anyone warning you how much more vulnerable an older brain is. By the time you're hearing this, you may already be taking 1 or 2 or 3 of these drugs. If so, this is your wake-up call to protect your memory, your safety, and your independence. First, anticholinergic medications. The name is a mouthful, but the effect is simple and chilling. These drugs block acetylcholine, a messenger chemical your brain uses for attention, learning, and memory. When you were 30, your brain had plenty of reserve to push through the side effects. At 70, the margin is thinner. Anticholinergics live under many labels. Older allergy pills that make you drowsy, motion sickness tablets, certain bladder pills for urgency and leakage, some stomach and nausea medicines, even a few older antidepressants and muscle relaxants. They dry you out. Dry mouth, dry eyes, constipation. But they also dry out your thinking. In the short term, they can cause confusion, blurred vision, and trouble focusing. In the long term, stacking them day after day can accelerate cognitive decline. Many older adults unknowingly build a dangerous anticholinergic load by combining several small doses across different products. An evening PM pain reliever here, a daytime allergy pill there, a bladder capsule at bedtime, and suddenly your brain is swimming against a current it can't beat. Picture Eleanor, 74, who was trying to be practical. She took a sleepy antihistamine for allergies and a bladder pill to cut down on overnight bathroom trips. Weeks later, she started misplacing her keys, repeating questions, losing her train of thought mid-sentence. "I guess I'm getting old," she joked, until her daughter laid out the bottles on the kitchen table. Both were anticholinergic. With her doctor's help, she switched to safer options and made a few behavioral changes. The fog didn't lift overnight, but within weeks she felt more like herself, more present, more steady. That is the pivot point, catching the problem while there's time to turn back. Second, sleep aids and sedatives, especially benzodiazepines and the Z drugs. Difficulty sleeping and daytime anxiety become more common with age, and the temptation is understandable. Take a pill, knock yourself out, finally rest. But the older brain does not handle these sedatives well. They depress the central nervous system, slowing thinking, slowing reaction time, blurring short-term memory. The effect lingers into daytime, increasing the risk of falls and fractures. With repeated use, they can carve ruts into your sleep architecture and your cognition at the same time, leaving you more dependent on the drug and less able to sleep naturally. What looks like relief tonight can become a trap tomorrow. Meet Henry, 78, a retired accountant. He was prescribed a bedtime pill to quiet his mind. It worked at first. Then the edges of his days dulled. He lost track of bills. He left the stove on. He felt like he was underwater. His family thought it was the start of dementia. Under supervision, he slowly tapered the sedative and started a structured sleep plan. A consistent wake time, light exposure in the morning, no late caffeine, and a simple wind-down routine. His sleep didn't become perfect, but his mind cleared. The dementia was not destiny, it was drug effect. Third, certain antidepressants, particularly older tricyclics and a few others with strong anticholinergic properties. Depression is real, painful, and treatable at any age, and no one is suggesting you white-knuckle your way through it. But not all antidepressants are equal in their impact on cognition. Some of the older options, which are still widely prescribed because they help with pain and sleep, also carry a heavy anticholinergic burden. In an older adult, that burden can look like early dementia, forgetfulness, slowed thinking, confusion, a brain that can't find its gear. The tragedy is how often the side effects are mistaken for the disease. Linda, 69, started an older antidepressant after a loss. Months later, she couldn't manage bills, appointments, or a simple grocery list. She feared the worst. A medication review revealed the culprit. With careful switching and support, her mood lifted, and so did the fog. Fourth, over-the-counter PM pain relievers and nighttime formulas. These are among the most dangerous for one simple reason. People assume they're safe because they're sold without a prescription. Look closely at the label. If it says PM, it almost certainly contains a sedating antihistamine, often the exact same anticholinergic ingredient doctors warn older adults to avoid. Night after night, these pills stack sedative and anticholinergic effects. Next day, grogginess, memory slips, slowed reaction time, then falls, then fear of falling, then less movement, then weaker muscles, and a shrinking life. Joe, 75, took PM pain relievers for arthritis and restless nights. Over a year, he became more forgetful and unsteady. When his doctor connected the dots and helped him stop, he didn't become 20 again, but he did become clearer, steadier, and safer. Here is the part that should scare you into action. These four categories often overlap in the same person. An older adult might use a bladder pill, a PM pain reliever, and a sleep aid while also taking an older antidepressant for pain. None of this feels extreme in the moment, but for your brain, it's like sitting in a room where someone keeps dimming the lights, one click at a time, until eventually you can't read the words on the page. So what can you do today to protect your brain? Start with a hard look at every pill you use. Pull them out. Prescriptions, over-the-counter bottles, supplements. Put them on the table. Read the labels out loud. Watch for certain tip-offs. PM, nighttime, may cause drowsiness, for allergies, for motion sickness, for bladder control, or for sleep. If you see diphenhydramine or doxylamine on an over-the-counter label, be wary. If you see older bladder medications or tricyclic names you don't recognize, flag them. If you take a nightly sedative or a daytime one that just takes the edge off, write that down. Then call your pharmacist and ask one life-saving question. Which of these have anticholinergic effects or are risky sedatives for someone my age? Pharmacists live for this. They can help you spot hidden dangers in 5 minutes. Do not stop anything suddenly on your own. That's how people get hurt. Instead, book time with your clinician to create a taper or switch plan that fits your life. If you've been on a sedative for years, a safe exit takes weeks to months, not days. If your bladder medication is anticholinergic, ask about alternatives with fewer brain effects and about non-drug strategies like fluid timing, pelvic floor training, and bladder retraining. If your allergy relief depends on a sleepy antihistamine, ask about non-sedating options, saline rinses, or allergy management that doesn't sacrifice your cognition. If your pain routine relies on PM pills, ask what daytime pain plan can make nights easier without drugging your brain. If your antidepressant is an older sedating type used for sleep or aches, ask whether a different plan could help mood and pain without adding confusion. Rebuild sleep from the ground up. Your brain's housekeeping happens at night. Suffocating it with sedatives steals tomorrow's clarity. Protect your sleep window. Fixed wake time, morning sunlight, movement during the day, a cool dark bedroom, no heavy meals late, no screens in bed. Make your bed only for sleep and intimacy. Learn simple relaxation skills, slow breathing, muscle relaxation, a gentle body scan. If insomnia has you in a chokehold, ask about proven non-drug therapy designed for older adults. Your brain can relearn sleep. Give it the chance. Watch for red flags that demand urgent attention, new sudden confusion, worse in the evening, a fall or near fall after a dose increase, getting lost in familiar places, hallucinations, a sharp drop in appetite or water intake. These can be drug effects masquerading as just aging. They deserve fast evaluation, not a shrug. If a sedative is involved and you feel unsafe, speak up now. If you're on a long list of medications and no one has ever reviewed them together, insist on it. This is your brain. You do not owe politeness to a pill that's stealing it. Replace fear with a plan. It's natural to feel angry or embarrassed when you realize a helpful pill may be undermining you. Use that feeling. Set a 2-appointment goal. First with your pharmacist for a quick risk scan, then with your clinician for a deprescribing roadmap. Bring a written list, photos of your labels, and if possible, someone who can help you remember the plan. Ask 3 questions for each drug. Do I still need this? Is there a safer alternative for someone my age? What's the slowest, safest way to stop if we decide to? You are not asking for miracles. You are asking for clarity. That is reasonable and wise. Build a brain protective routine as you prune risky meds. Hydrate. Move your body daily. Even a 10-minute walk matters. Eat real food with color and fiber. Connect with people who make you laugh. Challenge your brain with something you enjoy that is just a little hard. A puzzle, a language app, a new route, a simple instrument. Sleep with intention. Treat hearing loss and vision problems. Both make your brain work too hard and amplify drug side effects. Keep alcohol low. It multiplies sedation and confusion. These are not slogans. They are levers you can pull while your medication plan gets safer. Accept that over-the-counter does not mean harmless, and prescribed does not mean perfect for you. What matters is how a drug behaves in an older body. Aging changes everything. Slower metabolism, different water and fat balance, more sensitivity in the brain, more interactions between pills. A medication that was fine at 55 can be dangerous at 75. That is not failure. That is physiology. If you take nothing else from this, take this. The difference between a clear, independent older life and a slow slide into confusion is often a handful of pills, and the courage to question them. Anticholinergics blunt the very signals your brain needs to make memories. Sedatives flatten the rhythms that keep you steady and safe. Some older antidepressants trade mood relief for cognitive drag. PM pain relievers tuck you in while they dim your mind. None of these are inherently evil. They all have uses, but if they are part of your daily life, they deserve the same scrutiny you'd give to any threat to your home or your savings, because memory is your home and attention is your currency. You do not have to do this alone. Ask your family to help you lay out the bottles. Ask your pharmacist to translate the labels. Ask your doctor to put your brain at the center of your plan. If someone dismisses your concern, try someone else. The stakes are too high to accept it's fine when it isn't. A safer, clearer routine is within reach. Thousands of older adults have walked this path and found themselves again on the other side. Quieter nights, steadier days, fewer close calls, more confidence in their own minds. Do not wait until the next fall, the next scare, the next "where am I" moment. Pick a day this week to pull out your medicines, make the calls, and begin. You are not being dramatic. You are defending the part of you that remembers birthdays, tells stories, cooks from memory, pays the bills, recognizes faces, and says the right names at the right time. That part of you is priceless. Protect it like your life depends on it, because your independence absolutely does.